Dr. Sharmila Sarkar, consultant psychiatrist from Kolkata. Every year, 24th May is celebrated as World Schizophrenia Day. It is observed to increase awareness among general population, to decrease stigma associated with the disorder. Schizophrenia is a serious brain disorder. Generally, we call it a mental disorder. It affects an individual's thoughts, behavior, perception, their emotion, every aspects of an individual's life. It is quite common. About 1% of adult general population suffer from schizophrenia in their lifetime, and men and women are equally affected by this disorder. Now, regarding sign symptoms, typical sign symptoms are delusion, hallucination, disorganized behavior, thought, etc. All these symptoms can develop suddenly after an initial trauma or stressful life event like job loss, economic crisis, failure in exam, failure in love, getting threats from other people or quarrel, etc. Or all the symptoms can develop after an initial period of gradual deterioration in academic performance, a job, gradually become withdrawn to self, poor drive, poor motivation, etc. Delusion is a very common symptoms of schizophrenia. Delusion means fixed, firm, unshakable belief. Here, the person's belief cannot be removed from their belief system even after proper explanation. The person may think that people will harm him, poison him, or murder him, or the person are discussing among themselves regarding him, etc. Or these are actually delusion of persecution, delusion of preference. Another important features is hallucination. Hallucination means perception without any object. Hallucination can occur in any sensory modality, but in schizophrenia, auditory hallucination is most common. Here the person may hear someone is talking, telling him to do something, that is command hallucination, or giving running commentary on person's thought or behavior, that is giving running commentary, or multiple voices may discuss among themselves regarding this person. So this is a third person hallucination. Disorganized behavior, like they may become aggressive, violent, or shout out without any apparent reason, or just opposite, that is they gradually become withdrawn. Their social interaction is very poor social drive, poor dressing sense, and often they pass a sleepless night. Their academic performance, etc., become gradually deteriorated, or negative symptoms of schizophrenia may be there. And some speech problem may be there, like their speech often become incomprehensible, or could not understand, we unable to understand their speech due to disorganized thought. Now, regarding etiology, schizophrenia is a multifactorial disorder. No single factor can explain its etiology. Gene environment interaction is the most accepted one, that is, multiple genes are there, and then early childhood experience, birth complications, all ultimately leads to neuronal developmental problem. There is problem in neurogenesis, migration, synaptogenesis, etc. And all this may produce some neurochemical changes in brain during adolescent period or early adulthood, especially if they experience in kind of trauma at that time. Then increased dopamine or other neurotransmitter may be dysfunctional, and the structural changes are also found in case of schizophrenia, and their functional integrity is also disrupted. So these are a few things regarding etiology. Now management is very important. uh, very effective medicines are available now, and these medicines is devoid of previous medicines side effect, like if previously we used to found that these medicines produces zombie-like state, stiffness of body, salivation, etc. But nowadays, these newer generation medicines are devoid of such side effects. And if the medicine is taken under guidance of a psychiatrist, and the person takes medicines regularly, they can lead a productive life. And here the family members role is very important. Family support, their empathic attitude towards the person is very very important, and the key to lead a normal life of this person with schizophrenia. So it's very important to stay with them and give support when they require. Thank you.